Hi, I'm Tulsa Mayor G.T. Bynum. Policing has really changed over the last several decades. Used to be that police officers were out in the field to enforce the law. The reality of policing today is that the men and women in our police department are our community's de facto mental health first responders. And they need assistance. And that is why I am so thankful today to announce a partnership between the City of Tulsa, the Oklahoma Department of Mental Health and Substance Abuse Services, and Family and Children's Services, which is establishing the Police One Stop. This will establish a one-stop facility for our first responders to connect those in need in our community with the best mental health professionals in this region. It is going to dramatically enhance the mental health services that are provided to Tulsans and people in moments of crisis in our community. And this could not be coming at a more important time. As we go through 2020, we're experiencing a national recession, a global pandemic, and we're seeing a consequential escalation in incidents of domestic violence and mental health crisis here in the city of Tulsa. And so I am so thankful for this opportunity to partner up with the Oklahoma Department of Mental Health and Substance Abuse Services and Family and Children's Services with the Police One Stop to provide this crucial service to people in our community at this important time. Thank you.
Hi, Tulsa. The Tulsa Police Department is excited to work in collaboration with Family and Children's Services to offer a police one-stop location for mental health evaluations. We believe this is going to be beneficial to our department because it's going to allow officers to get back out on the street in a more expeditious manner, but also for our citizens in mental health crisis. Those individuals will have a private area to be dropped off by the law enforcement, and our law enforcement officers will then be able to quickly drop off that individual to a clinician. That clinician will then work to find the proper care for that individual in mental health crisis. We're excited because it changes the dynamics of how we used to do things, where officers were driving from one location to another, attempting to find space for an individual in mental health crisis. This stops all of that and allows our officers to get back on the street quicker, and it allows people to get the services they need in a more expeditious manner. Can't wait to see what this collaboration brings. I know it will bring and spark additional collaboration. So we're excited for you. We're excited for Tulsa. Thank you.
So in a comprehensive system, to kind of summarize that, what you have is one number that can de-escalate and talk and support people through their crises, that can also set up appointments for their nearest provider the very next day, or dispatch a mobile crisis team out for added support for that individual who, if they are not able to give all the assistance that that person needs, they can request additional support or take that person to the additional care that is needed right then and there. Now, the other thing that is part of a comprehensive crisis system is that number that you called originally, they also play a role in after a crisis has happened, and that they reach out then the next day, they make a call to make sure, did you have any trouble getting to your appointment? Are you feeling better today? What else can we do to support you? Have you found the help and care that you need? Were you able to make the changes in your living situation that were needed, if that's the case? So they reach back out and do follow-up of each and every person that they have talked to make sure that things are progressing in the right way. Well, I think it's incredibly important because people deserve the best care, the right care when they need it. And years ago, although we have continued to work to change this system, but we have a ways to go, the only option that you had was a yes or no into a large hospital, or no, you aren't getting care. And that only happened at the very highest end level of care. And the only determining factor was whether you were a danger to yourself or a danger to someone else. Well, that is not nearly enough. What we want to do is provide care to people when they need it. And that can range from all types of things. That can be, I have lost my job and I can't seem to stop crying. I have no motivation to get up out of bed, and I'm starting to have thoughts of harming myself. I'm not going to do it, but I'm starting to have thoughts. Well, that person, we want to provide help and care to as well. We don't want to say, oh, sorry, you don't meet the level of care to go into a hospital, so that's it. No, we want to take that opportunity when that person is reaching out to provide care and support and move them forward in a productive way, as opposed to waiting for them to get to the point that they are going to need a hospitalization. And one of the things that is so great with a comprehensive system is that once you have interacted with mobile crisis, et cetera, and perhaps you need some additional care from that, we have multiple layers of care for that person. We have urgent care centers. We don't have enough urgent care centers, but where we have them, they work beautifully. And what that does is like a 24/7 clinic. A person can walk in, they can come in by law enforcement, they can come in by family and friends, or a mobile crisis team could bring that person to the urgent care. At the urgent care, they can interact with virtually all layers of professionals, from a doctor, an advanced psychiatric nurse practitioner, case managers, therapists, and not only be out of the stressful situation that they may have been in so that they can have rest and respite, they're able to engage with any and all of these professionals, be started on whatever medication might start getting them in the right direction. Perhaps they hadn't been sleeping for days. We can ensure that you can get a good night's sleep so that you can look at things through fresh eyes the next day. We also can assess during that time for any addiction needs. And if there are addiction needs there, we can smoothly and seamlessly connect that person with whatever addiction treatment is needed. Now, what we have found is that 90% of the people who come to an urgent care center, that's the highest level of care that they're going to need. They don't need to go into a bed and stay a long period of time. By wrapping all that care around them right then and there, they are able then to move on to continued outpatient treatment and successful recovery. 90%. Now, when that is not quite enough, that person then, at the end of that period of time, they've come to the urgent care, they've interacted with folks, but more is needed, then they can move on into one of our crisis unit beds. Again, we have those throughout the state, but we need more. We would love for anybody who has a need to have an urgent care within easy reach of them and or a crisis center bed just not much further than that, or in a combination together. What we've found by crisis units, which what they do is they start to provide intensive care and treatment immediately, and they start a discharge plan that day. They are not looking at, hey, come in, you're going to be here a month, we're going to start slowly working on whatever issues are going on. They hit the ground running. They develop a safety plan, they start putting resources in place so that that person can successfully discharge to the community just as soon as symptoms are reduced enough to be able to function back in the community. And we find that having that layer of crisis unit, that 93% of those people do not need to go on to a hospital bed. So you have this layered system, one after the other, each a step a little bit more intense in terms of the treatment that it provides, but at each one of these opportunities, a person is able to get the level of care they need and move on to community-based care. And that happens throughout this entire layered system until only the very most ill people are needing to use a hospital bed for longer-term treatment. The community of Tulsa has not had a location within it where any person who is experiencing a psychological issue or an addiction issue and is in crisis has one front door where everybody goes. But with new and exciting partnerships between the Department of Mental Health, multiple providers, philanthropic organizations in Tulsa, we will be having a new front door. And that is where anybody who is in psychological distress can come in to the urgent care system and receive the help and care that they need. If additional care is needed after that, although we do know 90% of the time that is all that a person needs to get back on the right track. But if more care is needed, they can then move into a crisis center bed for additional care. And we also have the psychiatric hospital in Tulsa for those who are not able to be stabilized at those lower levels of care, which again, 93% of the people will not need a hospital bed when this system is used. What happens currently in Tulsa is that people for the most part are going straight to the hospital. And when that happens, your hospital beds fill up with persons that could be served in much less ways, much less intense, much shorter periods of time. So having this urgent care as the front door in Tulsa will help better utilize the resources in Tulsa and get persons the care they need when they need it.
Mental health crisis services are a critical piece of a successful mental health system. Local community leaders in Tulsa are committed to building a more robust system, as we know that inadequate crisis care takes a toll on community resources and can often result in human tragedy. A study was commissioned in which we learned that Tulsa had less than 75% of the psychiatric hospital beds needed for our size population. A study was commissioned and we learned that Tulsa had less than 75% of the psychiatric hospital beds needed for our size population. Consequently, 2,000 individuals in a mental health crisis who needed immediate psychiatric assessment and intervention had to be transported to other communities for care by the Tulsa Police Department. Delaying stabilization, delaying treatment is not the best practice for an individual in a psychiatric crisis. We know from experience that immediate access to help and hope and healing will save life. A plan for Tulsa was developed to limit police transport, reduce the time it takes for an officer to admit a client to a crisis center, and to create a one-stop drop-off for law enforcement. At the same time, plans were also developed to put in place increased local crisis stabilization services. The Family and Children Services Crisis Care Center is expanding its capacity to provide 2,000 more people rapid crisis stabilization services each year in a non-hospital environment. Individuals with more acute symptoms will be cared for in our short-term bed unit, which has expanded to serve an additional 200 persons each year. As the largest outpatient community mental health center in Oklahoma, we can help more people now through our successful crisis care continuum. Also, our staff will then provide a warm, direct handoff to very needed outpatient mental health care for continued